that they can respond to, harassment of public health officials and the chronic understaffing of the public health workforce, instances of political interference with federal health agency actions, which can contribute to the public's mistrust of these agencies, and policy and court decisions that could place dangerous limits on public health authorities at all levels. These opportunities and these challenges all happening now, they truly make the blueprint all the more pressing. Our report is a vision specifically for public health and prevention and bolstering the public health system to meet the growing challenges of the 21st century. Making sure our nation is safe and healthy is not the purview of any single agency, and that's why the blueprint recommendations cross 6 priority areas that, taken together, will help to promote health and well-being across the lifespan, protect national security, and support economic stability. Now, you may be noticing that we are gathering here today in advance of the 2024 elections. Regardless of the outcome of the elections, our roadmap for the next administration and Congress comes down to principles that we can and should all agree on. That all children deserve the opportunity to grow up to be as healthy as possible. That we all desire the opportunity to age with dignity in healthy and supportive environments. And that all communities should have the same level of protection from new health threats and the opportunity to thrive. Now, you're hearing that the Blueprint Report is intended for policymakers, for the administration and Congress, but let me challenge us that each of us has a role to play in promoting the public's health, in championing a strong public health system. And your presence here today, whether you're here in the room or you're joining us online, it demonstrates that you care and that you're concerned about the health, well-being, safety, and security of communities and our nation as a whole. I'm looking forward to us having this conversation together this afternoon. Now, our program today is going to help illuminate some of these critical issues, and we're going to begin with an overview of the Blueprint Report, and then we'll have 2 panel conversations featuring truly an incredible lineup of speakers for an engaging discussion on the path forward. And I promise there will be an opportunity for the audience to ask questions during the panel sessions. So are you ready for our conversation this afternoon? Yes. All right. It's my pleasure to introduce my colleague, Dr. Takesha Dewan Everett, the Executive Vice President of Trust for America's Health, who's going to present a high-level overview and key points from the blueprint. Dr. Everett?
Good afternoon, and thank you so much, Nadine, for that introduction. It is my honor to share with you some key aspects of our Blueprint Report that we've worked on for a number of months, days, years, tirelessly with a lot of you who are in this room, who are watching on the live stream and across the nation. This report was developed with input from our staff, our board of directors, as well as through convening and consulting with a number of public health leaders, academicians, civil rights organizations, community-based organizations, and community members. Through a process of socializing specific themes, listening to your ideas, and researching evidence-based solutions, we developed the 2024 Blueprint Report as a proactive perspective of what the 119th Congress and incoming administration should address to advance the public health system and our nation's health. This report has been endorsed by 14 organizations, each of whom were among those who participated in our convening process. Now, this group list is not exhaustive, but it definitely represents a cross-section of groups who believe that population health and the health and resilience of our public health system must be a national priority. We want to acknowledge them now and thank them for their support of their work on this report and throughout our process. The Blueprint Report, as Nadine mentioned, is structured across six key themes. The report has a number of chapters, each related to those themes, and the narrative in the chapter talks about the background related to that issue. We note the problem at hand, as well as the proposed solutions to address the public health challenges and opportunities before us. Each chapter also highlights the progress and stories of impact, showing that when Congress and the administration act to put the public health system first, we know that great strides can be made toward advancing population health. The chapters go on to note evidence-based solutions necessary to move our nation's health and well-being forward. Now, today I'm going to walk through the priorities and highlight just a few of the recommendations. We want to make sure that we get into the conversation, so rest assured what I'm highlighting today are just a few of the recommendations in the report. For a more detailed view of each theme, I encourage you to read the report in full, which can be found on our website at TIFA.org. That's T as in trust, F as in for, A as in Americas, H, health.org. Our first priority focuses on the important need to invest in infrastructure and workforce to ensure our public health system can meet the challenges and opportunities of the 21st century. Insufficient, inconsistent, siloed funding, and chronic underinvestment in public health have limited the public health system's ability to modernize basic public health infrastructure, provide essential services, and adapt to the new and evolving health risks, putting our nation's health and economy at risk. Policymakers have been able to when policymakers provide consistent cross-cutting funding to support the foundations of a strong 21st century public health system, we know that this will improve our infrastructure, it'll give us a larger, more diverse, and better equipped workforce, and ultimately modernize our data systems. To achieve this, the Blueprint Report offers several recommendations. Among them, promoting and increasing the overall funding for CDC to strengthen public health and save lives nationwide. Ensuring continuous improvement of public health infrastructure, investing in public health data modernization, and enacting the Improving Data in Public Health Act to better detect and contain health threats, and supporting efforts to bolster recruitment, retention, and resilience of the public health workforce. Our second priority is strengthen prevention, readiness, and response to health security threats. Here, we're thinking about the fact that public health hazards such as infectious disease, outbreaks, disasters, and bioterrorism are increasing, and they pose significant threats to our nation's security, well-being, and prosperity. Too often, federal responses for health emergencies are hampered by inadequate funding and challenges to public health authorities. The nation's high rates of chronic disease and underlying health and socioeconomic disparities create additional vulnerabilities. Our nation needs to redouble its efforts to prepare for and respond to the public health emergencies wherever they originate. We must build on recent progress and heed the lessons from the COVID-19 pandemic to protect the health of all Americans. To prevent, address, and respond to the health security threats we face in our nation, the White House should maintain coordination and leadership around public health emergencies and biodefense. Congress should expand public health emergency preparedness, funding for state, tribal, local, and territorial jurisdictions, as well as enact legislation to ensure access to vaccines for uninsured and underinsured individuals. Finally, the White House and Congress should renew the nation's global health security commitment. Moving to our third priority, because there are 6, so we're going to move quite rapidly going through all of them. The third priority is to promote the health and well-being of individuals, families, and communities across the lifespan. Increased life expectancy is one of the greatest public health advances we've seen in our country and across the world. And while there is vast variability in the life expectancy along racial, ethnicity, socioeconomic status, and geography, there was also a slight decrease in decline in our life expectancy in 2020 and 2021. It still remains true that people are living longer in the US than they were in the year 1900. And that's largely due to public health innovations and interventions. Yet in our country, the vast majority of the $4.5 trillion we spend on health is devoted to the treatment of illness and injury rather than prevention and public health. Promoting good health across the lifespan requires leveraging public health resources and expertise, and improving coordination between and among public health, healthcare, social services, and other sectors. Government at all levels need to engage community-based individuals and leaders and ensure that our funding and tailoring our programs are aimed at reducing health risk factors among all age groups. Focusing our efforts on those populations that are disproportionately experiencing barriers to optimal health is an additional key improvement to our nation's health that is necessary and needed. A deep investment in promoting the health and well-being of individuals, families, and communities across the lifespan requires a commitment from Congress and the incoming administration that includes increased funding for CDC's National Center for Chronic Disease Prevention and Health Promotion, enhanced and protected access to the Supplemental Nutritional Assistance Program. We need to make healthy school meals for all permanent. We need to pass the Preventing Adverse Childhood Experiences Act and increase the investment in CDC's ACEs program. We need to support SAMHSA's efforts to bolster the continuum of crisis care and fund CDC's comprehensive suicide prevention program. And lastly, we need to strengthen CDC's healthy aging efforts and support and sustain age-friendly public health systems in local, state, tribal, and territorial public health departments. Our fourth priority in our report is centered on advancing health equity by addressing structural discrimination. Structural discrimination and the resultant systemic inequities have been perpetuated through policies, norms, and practices in the United States for hundreds of years. Because of the long-standing and ongoing inequities, disparities in health have been persistent. We've seen increased risk of poor health and higher rates of deaths from preventable illness and injury among populations who have been disadvantaged. Achieving health equity requires an intentional focus, one that is focused on ending structural discrimination and making specific actions toward driving systemic change. Now, given the social, economic, and systemic factors that drive inequity, our response must be universal. We need a multi-agency, multi-sector, and coordinated response to eradicate health inequities and disparities. This requires concerted leadership. The incoming administration and Congress needs to make sure that we are addressing the allocation of resources and transform our policies in a way that advances equity. Now, I want to point out that several of our recommendations in this chapter and in other themes are centered around data. Let's be clear. Data shows us that the evidence supports the fact that we need to increase our focus on data because there are populations that are masked when we don't collect our data correctly. We know that disparities exist for those populations, but we can't fully grasp them because we have outdated data collection processes and systems. But it's important to note, while data is necessary, it alone is not sufficient. The incoming Congress and administration must have a focus on equity that includes regularly updating and reporting on the progress of equity action plans across all of the agencies that is inclusive of but extends beyond tracking disparities. We need to ensure that we have accurate and complete data collection that is able to report health information along a number of lines, including race, ethnicity, age, sex, disability, language, sexual orientation, gender identity, and geography. We also need to do what's right as a nation and respect and honor the sovereignty of tribal nations by rectifying the funding shortfalls that have woefully been going on for far too long and that are found as a result of Executive Order 14112 that allows for tribal self-determination and the promotion of trust in our tribal nations. Our fifth priority, I'm nearing the end, you all, so you get to what you're all here and waiting for. Our fifth priority is about addressing non-medical drivers of health. Now, there's growing recognition that non-medical factors are significant contributors to our nation's poor health outcomes, and yet our policies have not caught up with that Our actions and our investments aren't necessarily in the place that help us address those non-medical factors. The nation's health and economic security depends on us moving further upstream to address those issues and reduce health disparities. The public health sector must be intentionally incorporated into the planning and execution of health-related activities and initiatives and better align those disparate systems to approach population health. We also must make sure that community members are full partners and that policies extend to alleviating poverty. Some ideas and recommendations in our report include increased funding to $150 million annually for the Social Determinants of Health program at CDC and pass the Improving Social Determinants of Health Act. We need to continue to build on CMS's ability to support Medicaid, Medicare, and CHIP program coverage to address the health-related social needs of patients in their programs. And lastly, we need to amend our tax laws to increase economic opportunity for families by expanding the child tax credit and the earned income tax credit. Our sixth and final priority theme, which is very new for us having it in this report, centers on enhancing and protecting the scientific integrity, effectiveness, and accountability of the agencies charged with protecting the health of all Americans. Chronic underfunding, and as Nadine mentioned, the misinformation and disinformation that is rapidly spreading in our society, workforce shortages, threats to the public health infrastructure and authority, as well as the erosion of trust in our nation's public health agencies, are putting decades of progress at risk. It's putting the safety of our nation at risk. The next Congress and administration must ensure that the federal, state, local, tribal, and territorial agencies can do their job, making sure that our public health ecosystem have the necessary resources, the infrastructure, trust, and authorities that are needed to fulfill their mission. To achieve this, we must first maintain the existing structure of our federal health agencies, each of which have specific roles and specific expertise in protecting the nation's health. We must also protect the scientific integrity of our leaders and the public health agencies, allowing them again to do their job. We need to invest and prioritize in effective public health communications and reduce the spread of misinformation and disinformation. And we must reject laws that weaken the weaken or preempt public health authorities, which could threaten such basic public health protections as outbreak detections, vaccinations, and emergency response. This is just an overview of the recommendations in our blueprint. Again, I encourage you to take an opportunity to read the blueprint thoroughly. We've produced this through a thoughtful process, and we know that if we collectively work together towards accomplishing the recommendations in our report, we can advance the health and well-being of our nation and push forward through the unknown, known, and unforeseen challenges and opportunities of tomorrow. I thank you so much for your attention and your time, and I now welcome Dr. Gracia back to the stage to lead us through the rest of our amazing program this afternoon.